Dr. Jason West with one of the treatments that you probably haven't heard about that's amazing. I'm going to show you a little clip about it and then describe it, but this is actually a way to help cranial function, whether you call it nasal specific or endonasal, but it's a way basically to adjust the brain, affect the nerves, affect brain fog, help with headaches. Anyway, check this out. So Nicole came into the office and then she said, I want you to record the procedure so I can send it to my dad. So Nicole, tell everybody what is wrong. Like, what were you suffering from?
I have trouble with allergies, so then I end up with nasal polyps. And so Dr. J here does this wonderful thing called a sinus adjustment or endonasal, to where he goes up in and pops the polyps to where I can smell and taste for quite a while.
So she said, hey, I want to show it to my dad. He's having some sinus problems, and I want to tell everybody there's actually a really neat way to adjust the cranial sutures in your head. It's something that my grandfather taught my dad taught me. It's not something that I learned in school. It's just one of those things where you learn and do things after being in practice for 101 years, and obviously it wasn't me 101, it's our family's been in practice for 101 years. And so we do the endonasal, where you literally take the sutures. There's a little tiny balloon, we'll show it to you in just a second. What it does is it gaps the sutures. It's really helpful for allergies. It helps with taste, helps with chronic headache problems. It really helps people to breathe, and it's awesome. And Nicole said, you got to do it for my dad, so we're going to do that. Anything to add?
It also relieves the pressure on your ears.
Yeah, really good for ears and earaches as well. So we'll get set up. You'll see it in just a second, and we'll go from there. In, open your mouth, stick out your tongue. Works a lot better if you do both sides, just not one, even though most people will say, I don't breathe out of the right or I don't breathe out of the left. If you do it both sides, it works better, so let's do the other side. All right, Nicole, take a deep breath in, open your mouth, stick out your tongue. So that's the endonasal adjustment. It's been something that we've been doing in the office for about 70 years with really good outcomes, and as weird and as funky as it looks, it's one of the most requested procedures that we do. So what was it that you just saw? Well, frequently people come in the office, they have postnasal drip, they've got chronic sinusitis, they've got allergies, basically they can have polyps. Basically, they cannot get oxygen into the system through the normal pathway, so they turn into a mouth breather. They can't breathe very well at night. And oxygen is part of that three-legged stool for health. So you have good food, you have good water, and you have oxygen. I guess the fourth leg would be sleep. But if you have those, your outcomes for health are going to be really, really pretty good. So is there a different way to help enlarge the sinus tissue or open up those pathways, get, quote, a brain adjustment, unquote, or affect the pituitary gland, chronic earaches? And the answer is yes. And I was taught this through my father, who learned it from his dad. It's one of the neat things that we do in the office. And I just think it's a really good idea every once in a while to do a cranial adjustment.